गुड इवनिंग फ्रेंड्स। ये वीडियो में एक्सक्लूसिवली जो MBBS के स्टूडेंट्स हैं सेकेंड ईयर के एंड जिनको माइक्रोबायोलॉजी का एग्ज़ाम देना होता है, मैं उनके लिए बना रहा हूँ। तो एक बहुत ही कॉमन क्वेश्चन जो कि थ्योरी एंड प्रैक्टिकल्स दोनों में आ सकता है कि अबाउट लैब डायग्नोसिस ऑफ ट्यूबरक्लोसिस। तो ये बहुत ही कॉमन क्वेश्चन है, मतलब मैक्सिमम टाइम ये थ्योरी में भी आता है एज ए पार्ट ऑफ लॉन्ग क्वेश्चन या फिर प्रैक्टिकल्स में भी पीपल कैन आस्क। सो मैं यहाँ पे पूरा तो नहीं दे सकता, बट 2 मिनट या 2.5 मिनट में आई विल कवर हाउ टू राइट अबाउट लैब डायग्नोसिस ऑफ ट्यूबरक्लोसिस। सो सबसे पहले ट्यूबरक्लोसिस इज कॉज्ड बाय ए बैक्टीरिया विच इज कॉल्ड एज माइकोबैक्टीरियम ट्यूबरक्लोसिस। ये एक एसिड फास्ट बैसिलाई है, यानी कि इट रेजिस्ट डीकलरेशन बाई 20% सल्फ्यूरिक एसिड। तो इतना आप लिख सकते हो। एंड दिस इज ए बैसिलाई, एरोबिक बैसिलाई, and it causes tuberculosis. So tuberculosis spreads from one person to another by droplet infection, या फिर यानी कि जब कोई आदमी खांसता है उसको टीबी है, and whenever the next person inhales that he gets the infection. So TB again can be divided into pulmonary and extrapulmonary TB. So today so if you want to diagnose TB, so you have to collect samples accordingly. If it is pulmonary TB, the sample that should be collected is sputum sample. If it is extrapulmonary TB, then based on which part of the body is affected, वो part से आपको sample लेना है. So once it is collected, it should be sent to the lab as soon as possible. In the lab, so these are the techniques that you should use. In the lab, first of all, if it is sputum sample, then you have to decontaminate and concentrate it. So that can be done by Petroffs and modified Petroffs method. After that, in both pulmonary and extrapulmonary samples, the first step of diagnosis is doing a Zn stain. So Zn stain you can do, and then if you find red color के bacilli in a bluish background, then they are acid fast positive. So you can diagnose it as tuberculosis. After that, you have to do cultures. So cultures के लिए both solid and liquid media are available. In solid media, example is a Lowenstein-Jensen media, in which the growth may take place or growth can appear in 2 to 6 weeks, 2 to 8 weeks, and the typical colonies are rough, tough and buff type of colonies. उसके अलावा you can do certain biochemical tests to prove that it is Mycobacterium tuberculosis. In liquids media, there is a Middlebrooks media या MGIT वाले media by which you can put, and it lessens the growth time, मतलब 10 to 14 days या 10 to 2 weeks में वो growth आ जाते हैं. So apart from cultures, you can also do molecular tests like CBNAAT line probe assays या normal PCR, conventional PCR, by which you can detect Mycobacterium tuberculosis, and you can also detect drug resistance by these methods. Then उसके अलावा you can use lateral flow assay like MPT64 test, in which you put a sample, and if a band comes, then that is positive. After you put a growth, and if a band comes, that is positive. And the next method is by Montoux test, though not very reliable, but in your answer sheets you can write. So so that is a immunological test, that is Montoux test, that is skin test, that can be done. And then you can also write about interferon gamma assays. That means that is a serological test in which a serum sample is collected, and it is seen that a particular this thing interferon is getting stimulated or not. So based on this, you can elaborate all these methods, and you can write an answer on lab diagnosis of tuberculosis. So friends, if you like this video, please subscribe to my YouTube channel, and if you want to discuss any more topics, please go and write in the comment box. Thank you.